Hey guys, this is Khannur from Bass Kingdom. We have seen disastrous 2021 with our second COVID wave. In the month of January, we almost thought pandemic was over. We were liberal and we started wandering outside without any social distancing. So that is the reason we must not allow third wave to impact our country again. And that is why we arranged this live session where we'll be giving information regarding the third COVID wave. So that is why from here, I hand over the session to be continued by Dr. Praveen Khannur, who is a pediatrician in Ranebennur, a child specialist. So he'll be proceeding this session. Thank you.
Good evening. I am Dr. Praveen Khannur, children specialist, Ranebennur, Karnataka. Corona and children. Today I decided to go with Corona and children rather than going for affection of children in third wave that is predicted maybe in October or November. As you all know, Corona is a viral disease, RNA virus. The virus is SARS-CoV-2, that is subacute, severe, acute respiratory syndrome, COVID virus 2. And you must all be wondering why children are less affected in wave 1 and wave 2 compared to adults. It is said that children have got strong and young immunity to combat the diseases, and even the AC2 receptors are less responsive to the virus, and even sinus are less developed, and even these less responsive AC2 receptors, because of this, the virus will have difficulty to enter the body of the human being, particularly children, compared to adults. So, at the same time, if you compare the comorbidities in adults, children will be having very less number of comorbidities. And these are the main reasons why children are affected in wave 1 and wave 2. At the same time, why it is predicted that more and more children are affected in wave 3. As you all know, only 4% of the children are affected in wave 1, and if you compare to the wave 1, 8% of the children, 8 to 12% you can say, children are affected in wave 2, and they are predicting the same tendency may continue even in the third wave. So more and more children will be affected as the predictions go. Rather than scientific basis, it is more of prediction. But the main reason why they are putting means, if you take the number of adults, that is the total number of COVID positive cases in wave 1, it is less compared to wave 2. So if you take the total number of the children percentage wise, because adults are more affected in wave number 2. That's why children also more affected. The same tendency, if it goes in the third wave, more and more children will be affected with more and more severity. At the same time, the mutations of the virus may lead to more and more severity and more disease in the children, because the adults are already exposed. So many adults are already exposed in wave 1 and wave 2, and by the time the third wave hits our country, maybe in October and November, 50 to 60% of the adults will be vaccinated. So, since the children are not vaccinated, because vaccine is still not available for the children, so more and more children will be exposed for the virus disease. So, they are predicting more and more children will be affected in third wave that may happen in October or November. As you see, the comorbidities in adults, as you have seen in adults like diabetes, hypertension, cancer, and lung disease and other things, you may be wondering, even children have got comorbidities. So, the children with comorbidities will be affected more, even in third wave. That's why you have to take care of the children with comorbidities with utmost care. The comorbidities of the children may be just like diabetes, hypertension, heart disease, lung disease, liver disease, cancer like leukemia, neurological disorder, psychiatric disorder, obesity, malnutrition. Just like these are the comorbidities which the children may be having, and these children with these comorbidities are more susceptible. That's why even our local authorities and the government is screening for these children, so that they can give more and more care, and they may take more care to protect them from the third wave. And you may be wondering, if children get the corona disease, what may be the symptoms? That is, what may be the complaints of the children? To tell you frankly, there are not much difference between the symptoms of adult and the children, and the same symptoms, just like fever, cold, cough, myalgia, headache, even sometimes vomiting, loose motions, abdominal pain, and sometimes exhaustion. These are the same symptoms what you get in common cold and fever. That's why always you should suspect COVID disease in a child with the same cold and cough symptoms. So, when you cannot suspect, but you have to be more alert to find out the danger signals in children. What are those danger signals? Why I'm telling you about danger signals means, whenever you come across a child with the symptoms which I elaborated now, if they start getting these danger signals, you have to be very careful. You have to rush to the centers where all the facilities are available. The danger signals may be in the form of high fever, increased respiratory distress, indrawing of the ribs, lethargy. The child may get grunt. Grunt means a kind of sound because of respiratory problem. Child may become pale, sometimes even blue. Even all peripheries may become very cold, and sunken eyes. The child may become lethargic, may not be able to take food, dry mouth. If the child with the common symptoms start getting these kind of symptoms, you have to be very careful, and you have to note down all these danger signals so that you can take the child to higher centers where the facilities are available. Okay, once you come across the symptoms which are I have elaborated now, you have to get the investigations to diagnose COVID. The same diagnosis which you make in the adults, the same test, that is rapid antigen test and RT-PCR, that retrograde transcription polymerase chain reaction. The same test are that usually it will be a screen test whenever you suspect a particular person with COVID symptoms. Once you get a rat screening, if you are really become suspicious, then RT-PCR is more diagnostic. Okay, child has got symptoms, danger signals, the child is diagnosed to have COVID. What about management? Till today, the drugs which we are using for adults, that is whether just like a doxycycline, azithromycin, even you are using hydroxychloroquine and this ivermectin, and even injections like remdesivir, all these drugs still they are not having any proven efficacy against, means trials are not being done to what extent these drugs are going to act against the COVID in children. That's why these irrational usage of these drugs in pediatric, that is children, still is not approved. Then management means you have to give the supportive treatment depending on the complaints and the symptoms of the child, and you have to observe the child. If the child goes for any severity, then you have to take care all those respiratory problems or fall in the oxygen saturation with better oxygenation and high flow nasal channel and all those things you have to take care. There's no specific treatment as far as the children till today. And actually, you may be wondering why vaccines are still not used in children. Till today, actually worldwide, trials were not done as far as children are concerned for vaccination. But recently in India, Bharat Biotech is given a permission to go for the trial of the children between the age of 5 to 18 years. At the same time, already in America and UK, the Pfizer has already done the trials, and already it has got the permission from the government to use the vaccine between 12 to 18 years in America and England. Once Bharat Biotech trials become successful, even in India, we may get the vaccine in near future. What exactly they do in the trials? Once they have to calculate the doses. If you compare to the adult, dosage interval, frequency of the doses, and response of the child in the form of production of the antibodies to that particular vaccine. Once these trials are done, and if you really get positive results, particularly in the form of antibody response in the children, definitely in near future we are going to get the vaccines. Till that time, we have to be very careful. One thing I want to tell you, see, the viral transmission nowadays, mainly man to man, since the adults are already getting the vaccination, by the time that is October and November, more than 50% of the adults will get vaccines. Maybe because of that, why I want to insist the citizens to get the vaccines means, if you get the vaccine, yeah, you must have read in so many articles, the people who are vaccinated are having less morbidities, less mortality, less hospitalization. You should understand all these things. That's why we people should take the vaccination seriously. Once you take the vaccination, you will be protecting yourself, your family members, your children, and you will protect, and also it is for the safety of our country. Because once you get the vaccination, transmission of the virus, that link will be cut because of the vaccination. To protect the children, since the vaccination for the children is not available, to protect the children from the infection, I request all the adults to take the vaccination as early as possible. And now the people may ask about the pregnancy, breastfeeding, and all those things. See, the COVID positive mother, till today, there is no confirmed proof that the mother will transmit the virus to the newborn. And even in recent studies, it is told that 10% of the newborns may become positive. But till today, no newborns have not developed any COVID symptoms. And the question may be asked about the breastfeeding. It is told that even after the mother becomes COVID positive, the baby can be given the breast milk with the proper care of using the mask and the sanitizer as far as the mothers are concerned. If they are really careful and if they take the maximum care, then there is no prohibition as far as the breastfeeding is concerned. What the government and the authorities are really facing now is, now they have to balance the economy, education, and health, whether to open the schools or not. I request the government to vaccinate the teachers on priority, because once the teachers get the vaccination, parents will become more courageous, they will have confidence, and they feel the school is safe, secure, and they will not be having any hesitancy to send the children to the school. Otherwise, it is said that closing the school and preventing the children getting the education is more dangerous compared to the illness of the corona. That's why teachers should be vaccinated as early as possible. And at the same time, I request the parents to educate the children regarding hand sanitation, mask, and social distancing. And even WHO approved usage of mask above 2 years of the child. And you should better to change the mask every 8 hours to prevent the infection and to some extent suffocation. And nowadays it has become a trend to get the flu vaccine. Some people, they don't know why that flu vaccine used. Some people are thinking flu vaccine will develop the immunity against corona. No, it is false. Because flu virus will be having its own set of immunity that prevents only the influenza disease. But it is said that since during rainy and winter seasons, influenza illness will be more, if you take the vaccine, influenza vaccine, flu vaccine, the disease, particularly influenza, will be less in children. So the symptoms will be less, which are common between flu and corona. So the number of children which will be affected with common cold and fever will be less. So the testing will become less. So because of the decreased testing, the burden on the authorities will be decreased because of the negative reports of the corona. That's why because of that, indirectly that flu vaccine is going to help the society. And one more thing, as I told you already, I just want to give 2 to 3 points why children were supposed to affect more. The predictions are more in the third wave means, as I told you, one, adults are vaccinated. Second, 4%, 8 to 10% second wave. If the same tendency continues, more and more children will be affected in third wave. At the same time, virus mutations may occur and may affect the children, and the severity may be more in children. Because of all these things, government authorities and the local authorities are taking maximum care to find the solution for all these things by setting up more and more COVID centers, equipments, infrastructure, and the manpower. But the biggest challenge, once unfortunately, if the children are affected during the expected third wave of the corona, the real challenges are, see, in adults, what happens? ICU, 20 patients, 4 to 5 nursing or manpower will be enough, because adults can do their things on their own. They can keep the mask, they can eat themselves, they can do all other activities on their own. But in children, they can't keep the mask, they can't take their food on their own, they can't do all the activities on their own. Then what about the manpower? You require at least 1:1 manpower. And pediatric, that is children, it is very difficult for other doctors, means from other specialties, to get the symptoms, to identify the symptoms, to find out the signs, to find out the reason for the illness, and to treat the pediatric patients, because it's very difficult to calculate the dosage and to go ahead with the management. And the biggest challenge lies here, because government and authorities can set up all the infrastructure, all the facilities, COVID care center, and some manpower and all those things. But you need the manpower who are well versed as far as the children are concerned. So if at all government and authorities really want to combat the third wave as far as the children are concerned, they have to prepare the health workers, including the doctors, how to handle, how to treat the pediatric patients as far the dosage, signs, symptoms, treatment, managements are concerned. They need to get very good training from the very well known pediatricians who can train them in a proper way. So in the end, till we get the vaccines for the pediatric case, I hope within in near future we are going to get the vaccines for pediatrics. I expect all the citizens to take the vaccine to cut the link to protect the family and the society, with the hope that in near future we are going to get the vaccines for the children, and children will be protected, and within a few weeks or months, corona in our society, whether it is children or adult, it will be vanished. With lot of hopes, I wish, I hope to get vaccines for the children, to protect the children, to protect the country. I conclude my words. Thank you.
Okay. Thank you everyone for watching. So third wave just expected, and alarm signs are Maharashtra and Kerala cases are not reducing from past 2 weeks. That is one of the alarming thing. So just avoid traveling for the next 2 to 3 months. And last year we had observed the trend. In the month of July and August, the cases went on reducing. By the end of December, around January, cases were around 10,000 in the country per day. So we thought pandemic was over. That is the reason why it led to surge in second wave. Government did not they did not start the lockdown because of the financial cripple what they had expected, what they had faced in the first wave. That is the reason lockdown was delayed, and that led to the surge in the second wave. That must not repeat. So it depends on us, not the government. If each one of us contribute by maintaining the social distancing and whatever protocols are for COVID, then we can surely not expect the third COVID wave. If there is no third COVID wave, surely it is good for us and for everyone over here. So please do follow whatever the protocols are given. And we had few questions asked by you guys, so we will be clearing of them.
Yeah, I got some questions from the people who are actually participating in this session. One question is from Pradnya Gaikwad. The question is, does this wave really going to affect children, and what possible measures we have to? I think already I have covered this question's answer already. I think I repeated 2 to 3 times the same thing: getting the vaccine and adults getting the vaccine, and to have the same mask about 2 years, social distancing and sanitization. Other parents have to teach the children. I think you already got the answer. I need not repeat it. And the next question comes from Vaishnavi S. Whether the third wave has started. Maybe in Maharashtra, Kerala, Delhi, they are getting little more number of cases. But as such, we can't say third wave started, because in other this thing already the number of cases are coming down. And as such, of recent from last few days or weeks, so children are not much affected. Means the number of children who are affected has not increased. It is projected. It is expected in October and November. And next is Sandhya. How should we prevent this wave? As much as the same answer which Pradnya Gaikwad has asked, and this is in a different way. I think the same answer holds good for this also. And Lakshmi, how to protect our children? I think same thing I told. Adults and the parents and the family members should get the vaccination and try to cut the link till the vaccine is available for the children. That is the main, and with the same I told you, mass sanitization, social distancing, these things should. And another Chandrasekhar has asked the same question: how to protect our kids? Same answer, almost the same question, same answer. So I think if almost the same question, same answer. So I think if any suggestions, you can later on can call me, or can get the information from my side. As such, I feel and I hope I have covered almost all regarding the vaccine and the protection and the first, second wave, third wave, why children are not getting more and predicted to be affected more in the third wave, why adults have to get vaccinated, how to safeguard our children, and what are the symptoms, signs, and what is the management, and all these things I think I have covered. I hope you people are getting a very good bird view of this particular third wave corona, which is predicted in October, November. I hope you people are quite happy, and I just want to conclude my words. Thank you.
Okay, guys, thank you so much. Thank you, doctor. It was a wonderful speech where we got to know regarding first and second COVID wave, and third COVID wave is just expected, and it is in our hands to stop it. And in 1917, that is the worst affected. Like in the last 3 centuries, we had 3 pandemics, and most of them ended after third waves. So third wave most probably won't happen until and unless we are careless. So it is in our hands. So if you have like this particular speech, please do share to your friends so that even they'll get the awareness and the information regarding COVID third wave. And together, let us stop this COVID third wave and prove like whatever research and other countries which have faced third wave already, so that India can prevent third COVID wave. And right, like, I have a question. Sometimes naturally immunity boosting our children accept the vaccine. Yeah, in children especially the immunity is better, but they in the first and second wave they're responsible as carriers. But since now adults are vaccinated, only children like below the age of 18 who are not vaccinated yet, they get exposed. Because of that reason, already Bharat Biotech is undergoing trials with their vaccine. So let's see if that works. If that works, surely that would be vaccinated. And I request everyone to get vaccinated as soon as possible. And thank you. Thank you for watching. And please do share as much as possible. Let us stop this COVID third wave and enjoy their life as it was 1 year prior before the March 23rd was March 23rd of last year was the first day of lockdown. So let us together end it by 1 or 2 months. Thank you, everyone.